Hi, I'm Resa. I'm 28 years old, and it's been almost 4 years since I've been diagnosed with systemic lupus. In the summer of 2017, I think I got a mosquito bite that, after it healed, it got scarred very, very dark, similar to what was in my scalp. And when I went to go check that out at the dermatologist, they did a biopsy and it came back as just contact dermatitis or something like that. But after that dermatologist visit in March of 2018, I spent the next 6 months getting more symptoms that were more noticeable and more painful. So I started to get some lesions on my skin. I started to have a lot of joint pain. I was unemployed at the time, which was part of some of the stress that was the catalyst for these symptoms. But I was so fatigued. It felt like I got hit by a truck every single night and woke up the next morning feeling the pain of it. But yeah, all these things just kept coming up. And then eventually in the summer, I started to see these kind of red, raised pieces of skin on my cheeks and above my eyelids. My ears had the dark discoloration on them. I thought it was discoid when I kept seeing my scalp, my ears, and my skin. But eventually I found out that it was systemic lupus. I think my first uncomfortable experience was when I went in for testing. I mean, yeah, I had done my own research, but I'm not a doctor. I have a social psych research background, so I know how to parse through articles and look a little bit further than the first page of Google search. But I don't know, right? So I went to who would be an expert, and I only found them because I tried to research the best physician in my area, given I was uninsured. So going in there, I didn't have high hopes, but I mean, it's a specialist, right? So you just hope that they know more than you, obviously, and they do. But no one knows more about me than I do, I think. So I was really trying to give as much information that I could, starting from the scars on my scalp to the joint pain, to, every symptom that I started to experience, and even show photos of what I've been able to capture, the molar rashes, different things. And they were very rushed with me, like almost like, oh yeah, I've heard this before and I already know what it is. And that was so frustrating for me because I'm like, you have no idea who I am right now, and you don't know, even if it sounds familiar, like, but wait, there's more. Like, if you would just listen, you can kind of get the full scope. And I'm the best data that you have. So it was very frustrating for me. But even in my frustration, I would pause that person and say, like, can you listen to me for a second? Like, there's more. They tried to like make some quick on the fly diagnosis, like, oh, it might be Sjögren's or it might be rheumatoid arthritis. And I'm like, I feel like it's lupus. And they're like, okay, well, we'll test to see, which is fine. I was actually happy that they did the full gamut of testing. It was just, the means to get there was a lot of blood drawing, and I'm not used to getting so much blood drawn, and I also have a fear of needles. So it took a lot of people in the office to kind of support me with getting that testing done. But when I did get the testing done and I came back to get the results, just the way that the news was delivered to me, I think it lacked tact. I felt like I was getting the news of, a very serious illness. I'm not going to name any others, but I didn't feel like there was any tenderness or care given or shown to me in the way that was delivered to me. And gratefully, because I had done so much research and because I had already thought about the possibility of this being me having a chronic autoimmune condition, I guess I wasn't as surprised, but it was still hurtful and overwhelming and terrifying. So that was not a good feeling for me. So when she started talking about all these medications and like, yeah, you're going to be on Benlysta, you're going to have to come in and get injections once a week. You can't get pregnant while you're on this medication. Like, just a overflowing amount of information it was so overwhelming. And I did not feel seen or heard or even acknowledged, like, hey, what we usually recommend is this, and I don't know how you'll feel about that, but this is what we recommend. Like, it was just not about me. It was about patient has this. This is what we do for patient. And I refused to go along with that program. So I never went back. Yeah, as someone who's been healthy most of my life, hearing about this diagnosis was life-shattering for me. Probably not in the moment of being in the office, but definitely in the days, months after. It was the most life-changing moment of my year. I was only 25 years old, and everyone who knows me knows I'm such a go-getter, and I have like big, ambitious goals that I literally strive to attain. And yet, my goal after diagnosis was to survive. My goal was to see if I could make it another day. My goal was to see if I could make it another year. And some days, I literally wasn't sure. And not to mention the mental health effects that it had on me. I had never really experienced true depression and anxiety the way that I did after being diagnosed with lupus. If I'm a mental health advocate now, it's because I had to do a lot of healing, not just physically, but also mentally. And also frustrating to know that this disease impacts more often than not people who look like me. A lot of Black women are impacted by lupus. And it was just like, it was just a culmination of frustration. So even though I didn't go back to that physician, my symptoms did get more severe. I ended up going to the hospital for the first time. And I think at this point in 2018, I was actively flaring. That's the best way I could describe it. Like, so many things were happening and popping up. And it kind of forced me to kind of try again in terms of seeking help and some support with treatment. After that ER visit, I had already scheduled a new appointment with a new rheumatologist from a more prestigious medical network. And I went to see them, and I explained everything to them, and I, tried to share the diagnosis that I had. They were questioning why I was diagnosed with rheumatoid arthritis. They didn't think that was an accurate diagnosis. He had mentioned, starting me with medication. But it wasn't like, you have to do this or else. It was more like, I strongly recommend this based on what I've heard you tell me and based on like this hospital visit and stuff. At this point, I was very depressed and very anxious and just unsettled, not knowing if I would see another day, another week, another year. So I think I went to see him for a follow-up visit, and, he saw and asked about how like I was doing, and I shared it. I was open about my state. And he actually, really spoke to me and said, I think we can definitely continue to see each other and help you to treat, lupus. But I actually want to introduce you to one of my close friends and colleagues who is more experienced with this and might be more relatable to you in terms of your unique experience as a Black woman feeling anxious about this and having this new diagnosis. So reaching out to that physician who then connected me to the rheumatologist that I see now was actually the best thing that could happen to me. I'm grateful that physician, although he was extremely empathetic and listened and had good listening skills and just more supportive than the first experience, he also knew that I could benefit from a little bit of a different type of support as well. And I don't know that many physicians who do that, who say, yeah, well, I can definitely help you, but here's somebody who can help you even more based on where you're at, based on the fact that you're a Black woman, you're anxious, you're depressed, and you are very clear and stuck on the fact that like in the healthcare system, there's a long proven history of people like you not getting the care that they need or deserve. and the adverse effects of that. So I feel like that was the best thing that could have happened for me. And I'm so grateful, so grateful for that, because it introduced me to someone who really knows this stuff, but knows this stuff for someone like me. The research that she does, looks at patients of African descent. She's just amazing. And because she's amazing, and because I can connect with her, because I've built that trusting relationship with her, she has turned me over. I have considered clinical trials. I have considered contributing to how do we understand this disease and how it shows up in people who look like me, which is something that I would have never, ever taken part in before. I've also been more consistent with my care. Obviously, sometimes I fall off, but overall, she has educated me and allowed me to make my informed decisions, as opposed to just dumping the next best approved medication on me. So I'm very grateful for that. So my key message to clinicians who diagnose and treat patients with lupus, especially coming from someone who's lived that experience, is understand yourself and understand your limits. And understand that each person that's in front of you is a unique individual, that your unique experience could either be helpful or not as helpful to them. And I think that authenticity will help in how you show up when someone is in front of you, navigating, trying to figure out, one, what's wrong with them, or what's happening to them, rather. And two, what does this mean for their life? What does this mean for their family? What does this mean for their everything? Because it does mean something. So I feel like the more you know who you are as a clinician, the more you know what you do and don't know, the more you know how to ask more questions, I think the more helpful you can be to someone who's navigating this experience. I think that asking questions and listening piece is more important than any medication, any research article, any new groundbreaking updates in the field that you might have under your belt. Being able to see someone in front of you, hearing what their story is, hearing what the impact of what they're experiencing has on their story, and asking questions out of curiosity can help you to see how might you approach treating them. Because however you're showing up is also going to land with that person, and that can really make or break their health. It can really make or break, their trajectory. So, take that power seriously. And that's what I would say.